Good afternoon. I'm very pleased to be here in Etobicoke this afternoon at the Toronto Congress Centre with Councillor Michael Ford, who's the councillor for this area, Councillor Joe Cressy, who's the chair of the Board of Health, and of course with Chief Pegg and with Dr. de Villa. And I will just say that this, what you can see behind us here, is the result of months of work. We in fact started to put a plan together before there were even vaccines, knowing that when they became available we would have to have places to have people immunized across the city, and this is the result of that work that has been done over all that period of time behind the scenes. While we were waiting for the supply, the work was happening, and I was fond of saying that you could come and peer in the window here and see the furniture a couple of weeks ago that was ready to go pending our receipt of adequate supply of the vaccine itself. The teams have been working around the clock so that we could be ready to vaccinate people as quickly as possible. And I want to begin today by saying thank you to the people you don't often see. You do see the very capable leaders, in particular Chief Pegg and Dr. de Villa, who have overseen this process from every conceivable standpoint, from practicalities and technicalities through to, of course, the very important health considerations. But you don't see the rest of the team that have put this together, and it consists of many, many people who have done a great job, and they have our very great gratitude for that. Thanks to vaccine supply which has come upon us from the Government of Canada, this site at the Toronto Congress Centre will be up and running on Wednesday, and will be vaccinating up to 450 residents aged 80 years of age and over. And for that, I do want to say thank you to, as well, the professional people, the medical people, because the people who will be actually giving the vaccines here are people that we have been fortunate enough to recruit to this cause. And of course, we hope they'll be busy for weeks and weeks to come, vaccinating literally thousands of people in this site and in 8 other sites that we have set up as mass immunization clinics, in addition to all the other places that immunization is taking place across the city. Just today alone, there are 19 clinics that are operating in the City of Toronto, and that number has been repeated for quite a few days now, to the point where we have, with our hospital partners and others in the community, vaccinated already some 282,000 doses have been administered to people. The Toronto Congress Centre is one of 3 mass immunization sites that will be open tomorrow, Wednesday. They will be open, these clinics, the 3 of them, from 11 o'clock in the morning to 8 o'clock at night, and they will be operating 7 days a week. And we want to open up these sites and keep them running until the job is done. And the job here in this case is as many needles in as many arms as possible for all groups across the city, reminding people that right now we're dealing with people who have made a reservation, made an appointment, and who are 80 years of age or over. I will say this has been and will continue to be, right through until the last person receives a vaccination, a team effort. And that's been a team effort not just within the city, as between the Toronto Public Health and the emergency people led by Chief Pegg and everybody else in the city government, but also all of our health partners across the city. And I am confident that as we get these clinics, these first 3 mass immunization clinics, and we've indicated that more will be opening shortly, as we get them up and running, as people see that these clinics are open and sign up, that we will make huge progress on getting the population of the City of Toronto vaccinated so that we can bring this pandemic to an end. And I would urge all Torontonians who haven't explored, even if they're not in the age group yet. Right now we're dealing with people who are 80 years plus, and some remaining first category people that are first responders, and others that are put in the provincial priority list in the first group. But I would urge everybody to explore getting vaccinated. If you have any need for any information, we have lots of it available to people so that they'll be comfortable doing what everybody should do for themselves and for the sake of their family, their co-workers, their friends, which is to get vaccinated. This is a very important thing to help us wrestle COVID-19 to the ground for once and for all. For those who are in this group that we're dealing with at these 3 clinics, including this one starting on Wednesday, and those are people who were born in 1941 or earlier, if you haven't already done so, please book a vaccination appointment. You can go to covid19ontariohealth.ca, or you can go to toronto.ca/covid19, or you can call the provincial call centre, which is set up for those who might be more comfortable using the telephone. And that telephone number is 1-833-943-3900. And so, again, I say a profound word of thanks to all of those who've been involved in getting us to where we're going to be on Wednesday morning when this clinic and 2 other mass immunization clinics open and join the team effort that has been underway for some time now and that is going to be underway for some time to come until we can get each and every person that vaccination they so much need and they will so much benefit from. I think I'm the only one to speak, but everybody that's here is available to answer questions, and I think there are some questions that we might hear asked, so we will just govern ourselves accordingly.
So, Upper Canada College in Toronto is closing down after a dozen students tested positive for COVID-19. Most Ontario schools with confirmed cases are listed on the government's website. However, UCC is not. What is the reasoning for not disclosing outbreaks at private schools? As a public health issue, shouldn't this be public knowledge?
So it's unfortunate, of course, that we're seeing outbreaks in our schools, and these are important, things to keep track of, and certainly something that we're working on as the local public health department. When it comes to cases in schools, these are actually reported through the provincial website in terms of the specific cases that are happening in schools. And when it comes to outbreaks within the context of schools, we're posting those on our website at Toronto Public Health. We certainly do try to keep that list up to date. And, my sense is that we're continuing to work with our partners at the school in order to ensure a safe environment for the students and the staff in those schools and school environments, regardless of whether they are part of the publicly funded school environment or whether, in fact, they're of the independent school variety.
How many people are you expecting tomorrow, the first day of the clinics? And what percentage of the appointments during the first 7 days have already been?
So, thanks for the question. We, each of our 3 clinics for the initial week are what we call scaled at 450 appointments per day. And very happy to say that the most recent update I have from our colleagues at the Province of Ontario is all 3 of the clinics. So this one here at the Congress Centre, of course, Metro Convention Centre and Scarborough Town Centre are sold out, if that's the right term, are fully booked. So we are expecting a full house across all 3 tomorrow at 450 each. And then as we move through the weeks and the vaccine capacity increases, there's a corresponding increase in our throughput in the clinic, the amount of vaccine we're able to deliver, so that will increase proportionately as we move forward. We're doing really well on clinic booking. So not only are we fully booked tomorrow and for the next few days, my latest update I'm looking at, which was 1:30 this afternoon, shows that approximately 19,000 people have made their appointments, both first and second dose appointments, in City of Toronto operated mass immunization clinics. And of course that is in addition to the considerable number of people that have already been immunized and will continue to be immunized by our partner clinics that Mayor Tory spoke of. More than 3,500 people have booked appointments in city-operated clinics today alone, and we expect that number will both continue and increase as we move forward. So looking forward to a productive start and looking forward to seeing a large number of our people, of our residents get vaccinated beginning tomorrow.
I was reading a couple things when I was looking up here. I heard that there's language barriers. I don't know if that's the question for you. Can you expand on that, how maybe not everyone in Toronto speaks English?
Yeah, so we're certainly aware. Obviously, we're proud of the fact that Toronto is one of, if not the most diverse city in the world, and those are certainly things that have been taken into consideration. I will just speak to the front end piece. All of the information that we drive to, we post our information on toronto.ca, which is translatable in a wide variety of languages using the software and the services that are available on our website at all times. Dr. de Villa may wish to speak more about clinic ops. Just 1 second, please.
So over and above having information available in translated format on the website through the tools that are available there, we also at all of our clinical services have access to language and interpretation lines. So should that be necessary, we certainly have access to those resources.
One more. Obviously, you're vaccinating people over 18. What are some of the precautions that you have to help out some of the elderly that are unable to go?
So I think there are many things and features that are built into this particular facility and will be considered throughout all of our services. So first and foremost, there are a number of guides and people who can help people navigate through the system over and above the capacity for companions to come in with patients who are seeking to get vaccinated. We have a number of mobility devices and aids that are available for people to use as well, and we're well staffed over and above the immunizers and the check-in and the screeners. There are other ancillary staff around who can keep an eye on things, put out chairs on an as-needed basis, and really help people have a good experience in this clinic, recognizing that for some of our older clients, it's a bit of an adventure to come out to get a vaccine.